Hi there, I'm Jala Gupta, physiotherapist specialist orthopedics. Today I'm going to tell you how you can tie a crepe bandage, right? So, crepe bandage, many of us actually don't know, and we think that just wrapping it one after the other solve our problem. No. So, the main function of tying a crepe bandage is to reduce the swelling, to reduce the muscle spasm, or and to also immobilize the part, right? So once we're immobilizing the part, automatically you're reducing the swelling, and also you are reducing the spasm to get recovered soon. But if you are tying it one on the another without following the method, then you will definitely turn up into compressing your blood vessels and in turn obstructing the blood flow, which we don't need. Already the injured part has less blood supply, so we need more blood supply so that we can cure that area, right? So after following the RICE protocol, rest, ice, compression and elevation, the crepe bandage serve as a method of compression, right? So in case of head injury, obviously you have to go to hospital if it's a very severe injury. If not, if just slight bleeding is there, you can just prepare a dressing, the rectangular dressing, and you can place it over your injured area. Say for example, I've injured myself over here, just place it over here, secure it with the tape, okay? And then how you're going to strap it. So strapping you can follow at home if the person is injured and you need to take it to hospital to reduce the blood flow, right? So that more blood do not come out of the head. So to secure the blood inside, you have to wrap it. So there's a method for that. Say for example, I have injured my head over here and you need to take me to an hospital, and to reduce the blood flow from here, I'm just going to place a cotton gauze, and above that I'm just going to place there is a woven cotton white color net type of bandage for the injuries, you must have noticed, right? So use that above the cotton, apply a medicine or apply something to sanitize it, right? And then you're just going to on the top of that dressing, so start it. So this is the way, not this is the way, right? So follow this way. So I'm just, say for example, there's a dressing over here, right? Maintain the 20% stretch force, okay? That is very necessary. Maintain the 20% stretch force on your head while tying the crepe bandage. You can apply more than 20% in case of head because you have to stop the blood flow. Maintain one third difference over here, right? Take it like this, right? Once you're done with it, then in this turn, just come here, take the bandage inside, right? Start from above the head, secure the neck of the patient or whosoever is there. Again, maintain the 1/3 difference. You can watch my other videos by what 1/3 I mean. There should, after every turn, there should be a difference of 1/3, right? Just wrap it. Above the head also, it should be 1/3 difference. Tie, 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 tie. And just tie it on the head like this. So you can in your head, you can actually the stretch can be more than 20% force, okay? And just tie it, but take care, do not block the breathing passage, okay? Do not, because this crepe bandage is actually very wide, right? That's why I'm recommending to use that one, the cotton one, which is actually used for the injuries, okay? But if you're confident enough to use a crepe bandage, make sure that you are not blocking the breathing passage of the patient, right? So this is how you're going to do it. Just maintain one third everywhere while tying it. See, one third, one third, one third. That's very important. And 20% stretch. In case of head, you can maintain more stretch depending upon the injury. If I have just injured slightly and my head is aching, my muscles are sprained, so I can just wrap 20% force. This will help me to reduce my swelling and to reduce the muscle spasm. Hope you like it. Please watch the other videos also in the series. I have made the videos for the shoulder, elbow, wrist, knee, ankle. Okay, so if you have any questions, you can ask me in the comment section of my blog. Bye bye, up till the next video.